Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
Right. So to understand that, we need to know what are the types of glaucoma. So let's divide the glaucoma into two basic categories. One is called a primary glaucoma. The second is called a secondary glaucoma. What is primary glaucoma? It means that the patient has a defect in his own eyes, which is causing nerve to get damaged. The second one is secondary glaucoma. That means the patient has another disease which can lead to glaucoma. So if you have a diseased predisposing glaucoma, that is called a secondary glaucoma. But if you do not have a disease, you have a genetic defect or you have a predisposition to develop glaucoma without any secondary reasons, then it is called primary glaucoma. Again, in primary glaucoma, we have three. One is called a pediatric glaucoma from birth or from childhood. I'll not mention that because that's too less in number to actually get worried. But we have what is called as a angle closure glaucoma and a open angle glaucoma. So what is an angle closure glaucoma? Normally, in your eye, right?
Yeah.
So in a angle closure glaucoma, the gap between your cornea and pupil is less. Once the gap between cornea and pupil is less, you call it angle closure glaucoma. In these patients, the symptoms are usually known to the patient. So these symptoms could be intermittent blurring of vision, intermittent headaches, especially headaches after you are out from a dark room, or sometimes even severe pain. Pain with vomiting can be due to acute congestive glaucoma. So these are more common in younger age group and can be easily detected by the patient because he is symptomatic. But the open angle glaucoma has no symptom. Patient comes for routine checkup and it's the doctor who finds out that, okay, this patient has a weak nerve and does the test to find out how much is the nerve weakness, whether it is correlating to glaucoma disc damage or not, and accordingly we start treatment. So you can have two types, and in India you have 50-50 of that. 50% of patients can have angle closure and 50% of patients can have open angle glaucoma.
What are the risk factors for glaucoma and can it be prevented or slowed down with the lifestyle changes or medication?
Well, so there are a few risk factors. One is most common is age. As we grow old, glaucoma risk is more. Second risk factor is genetics. You have family history of glaucoma in your parents, your grandparents, you have a higher risk, 4 times more risk. And third, if you are having high minus power or a high plus power in the eye, that means your spectacles are thick, then you have a high risk. And last, if you are on drugs like steroids, if you have ankylosing spondylitis, if you have any autoimmune disease, if you have certain other systemic conditions, these are also risk factors to cause glaucoma. Okay, now how do you prevent? Unfortunately, we do not prevent it. We only treat it to prevent damage. So in case the patient has any symptom, as I already mentioned, or the patient is diagnosed by the examination of ophthalmologist, then you give medicines and you make the patient aware that glaucoma is a lifetime disease. So you need to be on medication for life. You need to keep consulting your doctor every 6 months or every 4 months or maybe every year, depending on your stage of glaucoma. So that is the most important thing. Patient has to understand that this disease, many people, they take treatment and after 6 months they feel how it is helping me. I'm not feeling any difference. They stop. So they need to properly get counseled about long-term effects of glaucoma. So then only you can prevent damage.
Agreed, doctor, what you said. How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
Yes. So as I said, the glaucoma is a disease of elderly age group. That means there is absolutely nothing to get worried before you're 40. It is only after you're 40 that in majority cases you may develop glaucoma, especially if you have a family history. And you show once a year. Until and unless the doctor tells you that yes, you have glaucoma, then the doctor will tell you, depending on the amount of damage, whether to come every 6 months or 1 year or 4 months. So that will depend on your amount of damage to the optic nerve and how the doctor wants to evaluate. So it's otherwise once a year is fine.
So, doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative, and we believe your participation will greatly benefit the patients.